Maternal. You tapped in, no filter, no fluff, real rap every time. Yeah, we talking about health, from the boardroom moves to the barbershop facts. We keep it 100, never turning our backs. Mine sharp like a suit with the fade on point. Every convo cut deep, this ain't just for the joint. It's the culture, the hustle, the game and the grind. You looking for truth, then you came to the right line. Keeping it 100. Facts versus feelings. Keeping it 100. Truth with no ceilings. Keeping it 100. No cap, just vision. We speak it, we live it. Your health is our mission. Keeping it 100. Facts versus feelings. Keeping it 100. Truth with no ceilings. Keeping it 100. No cap, just vision. We speak it, we live it. Your health is our mission.
Hey everybody, welcome to Keeping It 100, where we have these open and honest conversations to make sure you have the information you need to make good health decisions. I am your host, Dr. Krista Motley, and as always, I am joined by the one and only Georgie Mink Jr., the street practitioner. G,
Hey, good morning. Good morning.
how you living?
I'm okay. I'm good. Survived the storm.
You survived. I know. Well, I was scared our power was going to go out. Our power go out for every storm. And
Oh,
I
wow.
just prayed that it would not go out. I was going to stay at my mom's. I was going to stay at Jen. But I timed it wrong, and then we got stuck here, and we couldn't leave. But the power didn't go out. How'd y'all make out?
Pretty good. I mean, you know, all the hype, it lived up to the hype. So
It did.
I didn't expect it. I thought we was like overdoing stuff, and it was like the anticipation and all that, but it equaled the hype. It was a very bad storm.
It was a lot of snow. I knew as soon as they said it was like 12 to 16 inches, possibly, I was like, oh, we're going to get something. We don't know
Right.
how much we getting, but you predicting 12 to 15 or 16, that means we're going to get at least 3 inches.
Right.
So,
Right.
yeah,
Yeah.
the snow snowed. But I'm
Yes, it
glad
did.
you and your family made out okay, and I'm grateful that our power stayed on.
Oh yeah. Yeah.
Yeah, well, we are just going to hop right in it today. We have a returning guest to the Keeping It 100 podcast. Soon, even more sooner to be Dr. Shauna Williams, who is a trained doula, lactation counselor, and perinatal mental health therapist. She primarily serves Black families in the Philadelphia region, and she has a specialty in supporting families navigating pregnancy after a perinatal trauma, loss, and infertility. She is the bomb. She is a doctoral student whose research focuses on Black birthing people, perinatal loss, and maternal infant health outcomes. Welcome to the podcast. Very soon to be, Dr. Shauna M. Williams.
Hey, good morning.
Good morning, y'all. Thank you for having me.
Of course, we always want you on when it's time to talk about maternal health because you are the go-to person in such a topic. So thank you for coming back. So I mean, I know the last time you were on, you were soon to be doctor, but now you like soon to very soon, right around the corner. When are you expecting to finish up your program?
I should be done in 2027, in fall 2020.
Yes. That is amazing. And what are you doing your dissertation on?
So my doctoral research will still be on Black women, Black maternal health, and pregnancy after loss.
Beautiful. Are you doing surveys or like how are you collecting your data? Because I'm just wondering if there's people that you need me to connect you with. Well, I mean, I'm sure you have a lot of patients and clients, but if there's anyone else that you want to connect with, George and I could definitely help you with that as you build your research.
Yeah, thank you. So I have shifted into a different program that has a different expected outcome versus a dissertation.
Oh, okay.
So now I have a lot more creative options. I can do everything from write a book proposal to do a podcast. So
Yeah.
I am
Oh, that's
I have
great.
all sorts of creative options. So I'm not quite sure where I'm going to land, but it's definitely something where I want to include the voices of Black mothers going through this experience. That's really important. So
Awesome. All right. Well, just keep us posted as you get everything together. Anything that we can do to support you along this journey, We got you, sis. We got you. Awesome. So let's just like start from the very, very beginning and talking about doulas. Like, what is a doula? I'll tell you, when I was pregnant, I knew I had to have a C-section. Well, I was always told I had to have a C-section because I had fibroid tumors removed in my 20s, and they just said that I wouldn't be able to ever deliver vaginally, so I would just always have to have a C-section. So I, that's what they told me, and I believed that I have a reason to challenge it. Um, and so when I thought about what a doula was, I just thought it was for people that was having a traditional v v v vaginal birth, and that I wouldn't need a doula because I wouldn't need anybody like to help me push and to help me throughout the laboring process because I was having a C-section. But then I had talked to you after my children, and then I found out I could have had a doula. And I'm like, what?
Mhm.
I missed
Mhm.
out on having a doula. So I want to ask you, just to start from the very beginning, like, what is a doula?
So, a doula is a trained non medical professional who provides continuous emotional, physical, and informational support to parents before they give birth, during their pregnancy, during or after pregnancy and birth. So that can look like they'll meet with you in your home during your pregnancy. They'll be with you throughout your entire birth experience, if it's at a hospital, a birth center, in your home, and then supporting you during the postpartum period. So doulas can be a part of any of that process. We're not medical providers, so we don't perform clinical tasks. Our role is to really support the person during pregnancy, giving birth, postpartum, and their family. And the whole focus is to feel informed, respected, and empowered.
Beautiful. That is beautiful. I didn't realize I would miss out on such an important support person in the process. But that's okay because we're gonna make sure everybody else knows. We're gonna make sure everybody else knows who's eligible, who could take advantage, how to take advantage, and all those things. And when you think about like what are the biggest benefits to having a doula, are there any that come to mind? Because I imagine people will say, you know what, I don't need a doula. I'm married. I don't need a doula. I'm in a good relationship. I have a lot of family support. I'm good. Like I've heard that any pregnant person, I'd be like, you need to get a doula. And then I'll hear, well, we have enough support. And that could be the case. But in your experience, what is the biggest benefit for a birthing person to have a doula?
The greatest benefit, and this is shown in the research that's been done on doulas, there is a lot of research, and it all talks about that continuous relationship based support.
Mm,
So, that steady presence in a system that's fragmented and can feel overwhelming for people. And the combination of the knowledge plus the relationship is what matters. So, your family has the relationship, we can't replace that. The
hmm
doctors and nurses or midwives have the knowledge. We can't replace that. But we're coming in with the relationship plus some of the knowledge together, and we are there with you from the beginning to the end. And so I hear a lot of people say the same thing to me as well. Oh, I have a family member or a nurse will do that. We can't replace them, absolutely. But our knowledge and continuous presence is focused solely on you. And I've had so many parents and grandparents and aunts and uncles say, we couldn't understand why our loved one wanted a doula. We thought that was strange. But now that we've been with you, we could not have done this without you. We
Mhm.
didn't know what we needed. Those
hmm
nurses and medical staff are wonderful, but they have shifts, they leave, they change out. Who you met with during your appointments might not be who delivers your baby. All of that changes. Your family are coming in. This is their baby too, and you're their baby. And
hmm
so they have a hard time separating their own emotions sometimes when things are happening in the moment.
hmm
And they may not have that knowledge piece. So the doula comes in, and our only focus is you, right?
hmm
And having that combined, it really is a very unique combination that shows when we're there. There's improved birth outcomes, there's lower rates of unnecessary interventions, and people report a higher satisfaction with birth experience. And there's
Wow.
a really well known quote by this Dr. John Kennel who says, if a doula was a drug, like a medicine, it would be unethical not to prescribe it because
Mm.
of the
Mhm.
effect that we have.
So,
That's
Shauna, what's like the not to cut you off, Doc.
I'm good.
As far as like the history, when did we realize that this was an important part of the birth process? Like, I'm curious because I'm just thinking like back, like maybe like in the 80s and the 70s when it could have really been, beneficial and women just had to deal with these things and families had to deal with these things on their own. When was it kind of created and when was it like a certification? Like when did everything start to take place?
Right. Oh, you talking good now. I don't want to ramble too much, but historically, people have always given birth before hospitals and medicine was a thing. We were always giving birth in community. And part of that community would be someone who was knowledgeable about birth, right? A midwife, and someone who was there to support the midwife, but was focused on the person. But that person was a part of your community and your family was present for birth. They saw what was happening all the time. There was supports for the dad. There was supports for, your family and friends being there. So everyone had more awareness of birth. The short version is when the medicalization of birth happened, when we moved from a vast majority of people being born outside the hospital to inside the hospital, birth became a mystery. They weren't even letting fathers in the room. No one would be in the room with the birthing person. And the belief was these medical providers were like, we got it. We don't need anyone else. But what was found was that the way that the medical team does things, right? That in and out sort of that focus on us being the expert and you just laying there and letting us do what we feel should happen. There was something that was missing, right? And so there is this belief that birth was dangerous and awful before doctors got involved. That is not totally true, right? And then once doctors got involved, we actually saw continued challenges with well-being. It was in the 70s when there was a transition back to people saying, let's go back to the original ways of birth. There was a movement around that natural birth movement. When there was a study that was done where there was a researcher who was in the room while someone was giving birth. And their goal was to just be in the room and the doctors were coming in and out. And they were just supposed to be sitting there taking research, observing what was happening. And for some reason, they found out that everyone who was in a labor and delivery room with one of these researchers had better birth outcomes than everybody else. And so they started talking to the researchers, and the researchers was like, all right. When the doctors left the room, I could not talk to her. I couldn't ignore her. I started just encouraging her, cheering her on, and people were like, that's interesting. That makes that much of a difference. And when they went back in the history, they said, wait a minute, there was always someone there who was doing this. Sometimes that person had a specific role, and that in Greek history, that role was someone who was working for the family. Working is a non-offensive way of describing it, right? But they had to be there working for the family. They were called a doula. So they took that Greek term and they applied it to what they felt this role could be. And because of that history connected to that practice of midwifery, they added that history of the way midwives approach birth, which is much more holistic. And they said, we're going to combine all the knowledge together with somebody being in the room who's just focused on you. And that was how we came to see what we now know as doulas, the way they look in the United States. It's also very connected to the history of midwifery in the United States, specifically what we saw with Black midwives in the South and Irish midwives in the North. And as they try to put more of a level of focus and control over them, the way they had them do things is how they have doulas today do things. So it's a long history, but in general, it really is about we switched to medicalization of birth, something was missing. And this was that piece, that relational piece was missing.
Wow, good stuff. Good
Yeah, it was
stuff.
great. Good history lesson. Excellent. The other thing I was wondering, I know that the doula may not be able to be present at all the medical visits and with all the time that they're spending with their healthcare providers. And so we're wondering, what techniques do you give to your clients to help them advocate for themselves in the absence of a doula being there? Because I know that advocating is a lot of what the doulas do, but how can they advocate for themselves when a doula can't be present?
Right. So one of the things that doulas really focus on is helping parents understand their options, the risks, the benefits and the alternatives, and encouraging open communication with their care team and how to achieve that open communication. And so we start that process by educating parents while they're still pregnant. So even when you're going to an appointment, there are situations where doulas can come to appointments with you. That might be part of the way that they work. But if not, doulas are checking in with you before your appointment and after. We know what appointments are coming up. And so we're kind of prepping you, helping you think about it, things to bring up to the doctor, things to note to the doctor. So we're already starting that process. But even in the birth room, as doulas, we're trained to not speak to the provider directly and not for the client. So we're always helping parents speak for themselves. We're helping them learn how to clarify questions, articulate their preferences, and feel confident to speak up. Our advocacy is focused on self-advocacy to help our clients be active participants in decisions about their care by giving them all the information.
That's great. So it's already a part of the process. It's not a thing that you would have to do, and it's a part of how you work anyway, is to help them to advocate for themselves.
Yes. I sometimes tell parents to think about a doula almost like an attorney, right? Everything that happens to you in the legal system, your attorney might not be right next to you. And you also don't have to have an attorney. But your attorney is the person who understands the legal systems and is there focused on your outcome. You know they're going to be there at least when you go to court, and you're going to be meeting with them before the court date, right? Leading up to the court date and maybe a little bit after, right? So if you want the best outcome, you might want to consider getting an attorney. And that's how I talk to people about thinking about how a doula can be beneficial as it relates to advocacy, right? The person who is on trial might get up and say something that the attorney's like, I don't know, right? I didn't tell you to say that, but I gave you all the information needed so that you could get on the stand and speak for yourself.
Yes, I love that analogy.
Yeah.
That's brilliant. Brilliant. So how do you, because I imagine healthcare providers have a history to I guess the way that they are propped in society is like they know what's best, and they are going to tell you the best thing to do, and you just need to listen to them. And I imagine some may be put off by the presence of a doula or knowing that there's a doula involved. And so I'm wondering what's been your experience with that, and how do you find a provider who is open to you having a doula? Is that a thing? I don't know. Just wondering.
Oh, it is a thing. Absolutely. And I like to try to shift how I think about providers. Not that they are like villains coming in trying to just, say, you don't know anything. But they see birth so much that this is Tuesday, right? They don't understand why you're coming in with these strong feelings and opinions. They're like, just do it. I don't get the problem. Just come on. Like, we're moving on to the next patient. We getting you in, we getting you out alive, you and the baby, right? Go on out, right? And so there is this belief that doulas are not aligned with the medical system. That we're coming in and we're telling people to push back. But the truth is that is not what we're there for, right? We are there to support all sorts of informed choices and give the information and support people to advocate for themselves. And so, but knowing that that's a misconception about us, when I would start with families, I would say, does your doctor know that you are looking for a doula or that you're working with a doula? In your early appointments, and with a midwife, it's also good to do this as well. Go in to the appointment and say, so I'm meeting with doulas, and just see how they respond. If they give you any pushback, how open are they to why you want a doula? And if they're like, you don't need that, or some doctors will say, you cannot give birth with me if you have a doula, right? That sort of emphasis, you need to really reflect on, why would they not want something that has been shown to improve birth outcomes for me? What is their belief? Right? What is going on here? And I talk to people about, then you can now consider getting a new medical provider early on. You don't need to wait further along. So have those conversations early. When you are picking an OBGYN or picking a practice of where you're giving birth, you should be talking about it very early. And I will say that I also would offer, for families, like if maybe that could be a reason I could come to an appointment. If your doctor feels uncomfortable, so we can get to know each other. If your midwife wants to get to know me first, we can absolutely do that. Anything to reduce any tension, because I want you to feel at ease. I don't want you to be giving birth worried about the doctor doesn't like her and she don't like him. And, I don't want you to have to worry about any of that. My goal is to create your peace and comfort in the room. So having those conversations early, really listening for how they respond, seeing if they are open to meeting your doula or how they feel about your doula being in the room, all of that's important to know. Is my provider doula friendly? If they're not, really reflect on why might they not be. And bring those questions back to your doula that you're interviewing so they can talk to you about it. And based on that, do you need to shift the medical provider? Or do you say, no, I feel comfortable enough with my provider, I'm going to stay with them, but now you know.
I love that assessment that you suggested take place early on, and for the client to really feel that response and to feel the energy coming from the response and to use that to determine if this is going to be a good fit or not. So excellent, excellent point. G, I know you had a question about partners.
Yeah. With the doula, like you kind of touched on earlier, with the support, what role does the husband play, or your mate, or significant other?
Yes, they play an incredible role that cannot be replaced. A doula's role is to support the whole family unit. But I often hear partners say that they are concerned or they're not interested in having a doula. And even when people would reach out to me, it often would be the person who's giving birth. And I would say, can I speak to your partner? How does your partner feel about this? Because I know in traditional obstetric care, there's a history of leaving husbands and dads out. And so sometimes what I hear from fathers is a doula feels like another stranger that you're bringing into the room to push them out even further in the one moment where they really want to be involved. We work to empower partners to explain what's happening, offering suggestions they can try, and affirming their importance throughout the entire perinatal period, prenatal, through birth, and postpartum. I cannot replace a husband. The person giving birth and the baby, their bodies literally respond to your voice, your touch, your smell, your scent. I can't replace that.
Right.
And in no way am I going to try. So often we are focused on helping the partner feel more confident and less overwhelmed. We give partners permission to rest when needed, helping them know that I'm the knowledgeable person in the room as a doula, and I'm offering the support to you as well. So one of the things as a doula I would do is I'm bringing dad water too. I'm bringing that. You need something to eat. I'm going to get everybody something to eat because do you need a rest? Go ahead and take a nap. I got you. So when you come back, you wake up, you're going to be ready. And my favorite story, I had a family who the mother had given birth twice before I started working with her. And she was like, I'm going to tell you right now, my husband ain't going to do nothing. He ain't do nothing the first birth. The second birth, he bought video games. I'm not even expecting him. That's why I want a doula, because I know he's not going to do nothing. But this dad, right, when I started working with them, and I start from day one, including dad, teaching him, telling him what to do, how he can be a support, exploring what it's like for him to watch his partner in pain, talking about what the past birth experiences was like for him. By the time we birthed together, she was like, I cannot believe this. He was active from beginning to end. By the middle of it, I didn't need to prompt him. He was jumping in, doing everything that it was so wonderful. And she said, I cannot believe that. That is the most amazing thing I've ever seen. But dads often they don't get told what to do. And even when a well-meaning nurse will give dad a suggestion, then they leave. So now dad's like, okay, I don't know what to do now. Right. So being present to support both of you in your birth experience is my role, right? To help make the best and maximize the dad being there. We know fathers' involvement helps birth outcomes. So I want everybody to be involved.
Nice.
That's a really great story. Yeah, I like that story too. And I think it's an important story for people to hear. I think a lot of times women, we can not intentionally like take the power away from dads and from husbands, and we just do everything. Like, and we
Mhm.
assume that they know what to do, and we assume that they know what we want them to do, and if they don't do it, it's like, oh, he ain't do nothing, he don't do nothing. Now, I'm not saying this is the case of your client. Of course, I don't know her situation. I'm just thinking of in my own life personally, just assuming that a person knows what to do is not fair. And
Right.
assuming that they're going to do it is not fair either. It is communication, it is conversation, it is request and asking and having expectations set, like you said, involving the dad and the husband, and that is what makes the difference. And so when I had my kids, Bilal, he was there from day one. He was involved and did everything I did because there was no way I was going to be all tired and exhausted all by myself. And I got a husband here. So he did everything 100%. The only thing he could not do was breastfeed the kids, but everything else was
Mhm.
done. So that if I'm not here or if I can't be here, I know he can do it because he did it. And then I tell all my nieces, you have children, the dad needs to do everything. Do not let them off the hook from if they need to be making bottles, they need to be pulling out clothes, changing diapers, putting the kids in the tub. Like everything you do, they should be able to do it. And you should expect that. And they do it. But when we come in and take over and do everything, and then we get mad when the dad don't do nothing because we never expected them to.
Mm.
And there's a lot of reasons why, culturally things are functioning in this way. People often engage in this way in their relationships. But when it comes to giving birth, I really look at the medicalization of birth in the system
Mm.
because they send a clear message that dad is not the focus. And again, I don't think it's intentional. I think it's we're focused on you giving birth and you and the baby going home. So that's
Mhm.
where all the focus is. Um, and making sure dads are involved and have that information from beginning to end is the way that we're going to see a difference. And the person giving birth, often that's when you expect the dad to turn on, but you're the person giving birth. You can't give the orders. You shouldn't even have that burden. That's unnecessary. You shouldn't have to be fussing and fighting to get your partner to do anything. You have to focus on yourself. And so a person like a doula can be there to support and guide dad through how he can be helpful. And every, partner is different. They may or may not want that sort of thing, but I found that when we start from the beginning and I include dad early on, we know each other so well. I kind of know his strengths and weaknesses too. I know what's going to trigger him and what's not going to trigger him too. So I'm
Mhm.
able to support everybody in the moment to play their position to the best of their ability.
Nice, nice. You know what else came to mind, Shauna? Thinking about like a female that might not have anyone.
Absolutely.
Like, like it might be a younger woman or somebody or whatever the case may be, and she might not have family like that. The man might not be available around. So, I mean, it would be a big part in her life to have a doula. Yeah.
Yes, yes, I've definitely supported mothers like that. It's heartbreaking, honestly. Um,
Hmm.
but I am so thankful that I can be there for them. And I've even been in situations where I'm supporting someone giving birth and they got their partner in their family. I look over and it's a young mom by herself, and I'll be like, "Ooh, I want to go hug her just for a minute." Like
Right.
it's so hard to watch someone go through that alone. Um, yeah, doulas can be a support there. We can't replace all the support you deserve, but we can be a big, big help in those sort of situations.
Hmm. Hmm. Hmm.
Awesome. So how do people find doulas? How can they find a person to help through their pregnancy?
Mm-hmm. So generally, just like speaking from like nationally, if you're someone anywhere in the country who wants to find a doula, there is a couple of directories that you can look in. There is one, the most well-known one is called doulamatch.net. So you can look on there and locate doulas. There's also some directories if you're looking for a certain type of doula. For example, if you are a Black mother, maybe looking for a Black doula, you might look at the National Black Doula Association, and they have their own directory. But what I hear most people most commonly doing is that they, in their appointments with their provider, they bring it up. And if their provider is open to doulas, they will ask for a recommendation. They will talk to other mothers in their community and ask. And once you hear about organizations and things like that, that is how you find it. But I do, encourage people. There is that broader view of how to find a doula, looking at like those national directories, but then there's also making sure you're having conversations with your provider, other people in your community, because sometimes there can be a whole community organization you don't know about, right? Like in Delaware County, we have the Foundation for Delaware County, we have Petaway Pursuit Foundation. But if you don't know other parents who can tell you that, you might not find out about it. You can also ask your insurance company if there's assurance that pays for doulas. Not all insurance does, but sometimes they will say, yes, we have providers or organizations that we partner with. So those are some ways that you can start to learn about what doulas are available in your area.
Thank you. I'm glad that you mentioned Petaway Pursuit Foundation. They're a good resource for birthing people in Delaware County. And I think they also serve the Philadelphia region too, or are they
Yes.
just Delaware County?
Mm-hmm. Yeah.
Okay, good. And then I know that the Foundation for Delaware County also has a doula program where you get a free doula, so you don't have to pay for the doula. And so getting in contact with the Foundation for Delaware County would be an excellent resource. I refer any pregnant person that I am engaged with, I refer them immediately to get a free doula if you're in Delaware County. So that's another good resource as well. Well, now, what about becoming a doula? Do you have to have a college degree to become a doula? How does that work?
Actually, you don't. We doulas, to become a doula, typically you complete a training program through a recognized organization. Some of them are led by midwives. I've also seen people apprentice with midwives, but generally you complete a training program. And in that program, you're learning physiology of birth, comfort techniques, communication skills, ethics, and advocacy. The most well-known programs are DONA, the Doulas of North America, and CAPA, which stands for Childbirth and Postpartum Professional Association. So it starts with a C. But those are the biggest training programs, but there is many, many other reputable and amazing programs that exist. And so if someone's interested in becoming a doula, I encourage them to explore different programs and think about the population they want to serve and specialties that they're interested in. So if you're very interested in Black maternal health or trauma-informed care, or like me, so I work to support people who are navigating perinatal loss or pregnancy after perinatal loss. There are doula training programs that specialize in that. So you can get that as part of your education. After you complete the training program, you have to complete supervised births, continuing education and certification requirements. Even though certification isn't legally required in most places, that is typically the end of a doula program. You earn that certification. And all doulas who are, dedicated to their craft, we do continue learning throughout their career. So I've seen multiple doulas who take multiple doula training programs to get all those specialties. Sometimes doulas become lactation care providers or childbirth educators. They just keep learning so that they can be better in serving the families that they work with.
Mm-hmm.
Awesome. I know that the Foundation for Delaware County also has a doula training program. They have grant funds to cover it, so I don't even think it has a cost. So you can become a doula by getting trained by the Foundation for Delaware County as well, which is an incredible resource. Excellent. Now what about male doulas? I know there's th
Mm-hmm.
that's a thing too. Do you work with male doulas? Doulos.
Doulos. Some folks have started calling themselves doulos, yes. So there is an emerging population of men who say, we feel that this is important. And what I hear a lot of them saying is, we want to support having the whole family unit, men and, their partners, being a part of the birth process. So they're very focused on supporting men around the things that they haven't gotten culturally, or the things that might be taken or kind of pushed away from them in the obstetric care, to make sure they are on it. So I really appreciate male doulas or doulos, and the work that they're doing. In Philadelphia, this area, we have a big community of male doulos, which is really, really wonderful. And again, their focus is supporting these families, but really having that special eye and ear for how that male partner can be involved and supportive throughout the process.
Nice.
Amazing. Now, if anybody wants to contact you and take advantage of all of that you have to offer, all of your greatness, how can they find you?
Yeah, so people can find me at my website, which is myswdoula.com, MY, S is in Sam, W, DOULA.com. or they could email me at Shana, SHANNA, at myswdoula.com.
Beautiful. Thank you, thank you, thank you. Now, I have one last question for you. What is the podcast where you can always tune in for the latest entertainment and information conversations about health?
Well, keeping it 100, where else?
Hey. Thank you so much, Shauna, for being here today. We look forward to following you along your educational journey and all the things that you do to support our women. Thank you, thank you, thank you, Shauna.
Thank
Yeah,
you.
appreciate it, Shauna. Thank you.
Thank you.
Have a good day. All right, so talking about maternal health, I want to kind of bring on just to raise awareness for infant mortality too. Especially considering the environmental causes of infant mortality. And so we know that Chester, particularly Chester, has high rates of infant mortality, almost 4 times the national average, which is very disturbing. We know that one of the factors that contribute to that is the poor air quality and the older housing stock. We know that lead is a big issue in Chester, and so if a pregnant person was exposed to lead as a child, the lead never leaves their body, and it could potentially leach into through the placenta to the unborn child, and that can increase their risk of infant mortality. And so, what I want to do is just encourage pregnant people, people that are considering becoming pregnant, especially if they are pregnant, to talk to your doctor about getting tested for lead. There's nothing that they can do unless the levels are super high to remove any of the lead, but there are some things that can be done when the clinician knows that you have high lead levels that could potentially impact the child. So talk to your doctor about having your lead level tested if you are pregnant or considering getting pregnant, to decrease the risk and the danger that lead exposure can cause your unborn child. So that was our little health corner. I mean, our environmental health corner for the day. Remember, we do have our blood pressure program happening. So if you're interested in signing up, you can go to healtheducated.org, click on the link to sign up to join our blood pressure program, or you can scan the QR code there. It's a fun program. You get a free coach, you get a free monitor, free classes, all the things are free, and you walk away with lower blood pressure and better risk of cardiac or heart health. Better outcomes as it relates to heart health. So
For sure.
keep your numbers in check. How your blood pressure doing, G?
Good. I take my blood pressure every day with orange juice.
You take your meds with your
Yeah.
OJ.
Yeah.
But have you taken your blood pressure
I
recently?
actually started checking it. I just
Okay.
started checking it. Yeah. I just started checking it, and it's staying consistent. So it definitely works. I mean, it's just about being you got to be obedient, and it just has to become a part of your everyday process. The same way you brush your teeth and do all these other things that you normally have to do, you have to make it part of your lifestyle. So
I'm
yeah,
proud of you, G.
yeah,
Proud of you. Well
yeah,
done. Well
yeah,
done.
yeah.
All right. Well, that's all we have for today. Thank you all for tuning in and for watching, and we will catch you next week.
All right.
Peace.
Keep it 100.
Keep it 100. Truth with no ceilings. Keep it 100.